Hi everyone, happy Leap Day. It's noon and you're watching CBC News BC. I'm Benit Brach here in the CBC Vancouver newsroom. Lots to tell you about today. So starting with heavy snow that has shut down stretches of two highways. Highway 1 from Revelstoke to Golden is closed due to avalanche risk. There is no detour for that one. The Coquihalla Highway is also closed in both directions from Hope to Merritt. Now that's following an early morning crash and wintry driving conditions. Environment Canada says the Coquihalla is still under a winter storm warning with more snow that's coming. And there are still several warnings on the Trans-Canada Highway, Highway 3 and 16. So yeah, really plan ahead for the weather if you are hitting the highways. And all you backcountry enthusiasts are probably very excited about the snow that has fallen in parts of BC over the past couple of days. But Avalanche Canada has just issued a warning for avalanche risk that could be very dangerous, especially parts of the BC interior and parts of Alberta. And that's because of a widespread rain crust that's now been buried with new snow, creating really weak layers. So it's something that backcountry suppliers are also noticing.
Whenever there's a persistent slab problem or a persistent weak layer in the snowpack, it makes things much more unpredictable. We saw the same thing happening last year.
Avalanche Canada says if anyone is planning to be in the backcountry, stick to those lower angle slopes, take some avalanche skills training courses, and of course have proper gear and know the forecast for the area that you plan to visit. The special warning will remain until March 4th. And the federal government unveiled its national Pharmacare bill this morning, which proposes coverage of contraceptives and diabetes medication. But what's the impact for British Columbians?
This will mean there'll be a significant reduction in costs and reductions in financial burden either on your household or on your workplace that pays for your private insurance for those medicines. So that's a real big boost for people in British Columbia who need diabetes treatments. And for people in British Columbia who are using contraceptive treatments.
Now, if the bill passes, the next step is to negotiate funding with provinces and territories to cover the cost of providing some medications for free. And a heads up for Mexican nationals visiting Canada. The federal government is reimposing some visa requirements starting today, and it's all aimed at slowing the influx of asylum seekers and to curb an increase of illegal crossings from Canada into the U.S. Now, we went to IVR to ask people how they felt about this.
That's very upsetting for us because we are trying to make Canada a living. So for our family, it means another step or another boundary.
It's kind of sad, again, because that'll put restrictions on people who come and visit for vacation only, but I think it's a necessary measure to take.
Yeah, I was kind of surprised. There's a lot of people that, will be affected that just wanted to, come visit their family. We have a daughter here, and so yeah, it will be amazing that our parents could come, but now it's going to be harder. So yeah, I think there's just a lot of collateral damage.
Now, that new visa requirement is expected to affect about 40% of all Mexican travelers to Canada. Okay, and that's it for us. I'm Benit Brach. You're watching CBC News BC. Stay tuned for BC Today. That's coming up next. See you later.
Good afternoon, and thank you for joining us. Health Minister Mark Holland released the long-awaited details of the federal government's Pharmacare plan today with a commitment to cover some diabetes treatments and contraception. But does this go far enough to address your health needs? And what would you like to see covered? And amid an increase in demand for IVF treatment, the provincial government will pay for one round of treatment. We want to hear why you turned to IVF and what your experience has been. I'm Amy Bell, sitting in for Michelle Elliott, and this is BC Today. Thank you so much for joining us on CBC Radio 1, CBC Television, and live streaming on the CBC News app, cbc.ca/BC, and on the Vancouver YouTube page. And this is February 29th. This is the edition of BC Today. So today is your birthday. Happy birthday to you. We would love an email, and we'll say hello to you on air. We want you to tell us what it's like being a leap year day baby. Our email address is bctoday@cbc.ca, and we'll read some of your emails later in the program. That email address, again, is bctoday@cbc.ca. Ottawa has released the long-awaited details of its Pharmacare plan today. The legislation would cover diabetes and contraception to start, and the federal government says it plans to implement universal single-payer coverage for other medications in the future. Federal Health Minister Mark Holland says the plan aims to improve equity.
Waking up in a country where every single woman has access to the contraception she needs to control her future is an absolutely critical part of having a just society. This is about health equity. It's also about affordability, about making sure somebody who's asking, can I afford the contraception that I need to be able to control my future? Or do I pay for rent or food in a time of global inflation and challenge? Many will talk about how much this costs. I hope we talk about how much it saves. Not just how many lives it saves, but in the British Columbia example, and I want to thank Adrian Dix, who the work that British Columbia did to lead the way on universal contraception, has demonstrated really that it appears to be saving more in money than it costs.
Federal Health Minister Mark Holland. If the legislation, Bill C-64, passes, Holland will begin negotiating with the provinces and territories on a funding commitment. Today, we're taking your calls on this. What does the diabetes and contraception Pharmacare plan mean for you? And what else should Ottawa's Pharmacare plan cover? Call us, 1-800-825-5950, 604-669-3733, pound 690 on your cell phone, and you can email BC Today always at cbc.ca. Joining me now is Dr. Ali Zentner. She is a physician and specialist in internal medicine, diabetes, and obesity with Revolution Medical Clinic in Vancouver. Hello, doctor. How are you?
I'm good, Amy. Thanks for having me.
Oh, thanks so much for joining us. So what do you make of this plan from the federal government?
I think, as a physician and as someone who has been a champion of socialized healthcare for the last 23 years on the inside, it's very much a long time coming. I think Canadians need to understand that we have universal health care until you leave the hospital. And medicine's landscape is such that much of what we do in medicine, not just in primary prevention, but also in sort of secondary and chronic disease management, the landscape of medicine is outpatient medicine and chronic disease. And much of that happens outside of the hospital through medications and such. And so that aspect of care, that key important thing, is something that's essentially a two-tiered system right now. So I see patients for free through a socialized healthcare system, but anything I prescribe depends on what drug coverage they have. So it's definitely a long time coming, but I don't think it went far enough.
And as we said, British Columbia already has a Pharmacare program, which includes many forms of contraceptives and diabetes medication and supplies. So I guess the question is, what would that legislation mean to people here, if anything?
It's really hard to say because,
Okay.
as you know, the details are still very sketchy as to how it affects things. I think, what this has done from what we can gather, and let's just say British Columbia we haven't just advanced in these areas. For example, our diabetes formulary with some of the newer anti-diabetes medications, which have been life-saving and offer cardiovascular benefits, et cetera, those that are on formulary in BC are not covered in this nationalized healthcare system.
Oh, okay.
So yeah, so let's be clear that even though it says diabetes coverage, it's quite frankly the base. It's sort of 1990s diabetes coverage, whereas British Columbians have 2022, 2021 diabetes coverage, where we're getting there, absolutely. And so I think it's hard to know how this will affect British Columbians. I certainly hope it doesn't take us back. But I think the Canadian system, although it talks about a beginning. My praise is that, finally, we've been talking about this both at the healthcare level, but also at the government level for years. But my criticism is it almost felt as if it was trying to get a foot in the door and appease sort of policymakers to take this on, as opposed to really, truly address what the intention of a national pharmacare system is. And to that point, it's not just providing care. The problem is if you have a national system, then realistically what you can indeed do is you can negotiate for far cheaper prices of medication. It would put Canadians, it would put this country in a huge leadership position to get much more reasonable pricing for the more modern, more expensive medications that, quite frankly, are off limits even in provincial pharmacare formularies.
That's an interesting point. I'm going to bring in a call now, Doctor. Chris in Cranbrook. Hello. Thanks for joining us today.
Hey, how you doing?
I'm doing well. How are you, Chris?
Okay.
Okay.
And I'm listening to your guest that, oh my God, she's brilliant.
She is.
Yes.
That's why we had her on, Chris.
Dad, is that you?
Well, I was wondering about heart medication, like blood thinners and high blood pressure, low blood pressure, and things like that. Why weren't they covered?
Very valid point, and Dr. Zenter, I think that's what a lot of people are wondering when they see these details, why it is just, focusing on diabetes and contraception when there are so many chronic diseases that people have been struggling with for years and will continue to be treated it for years, why these have been left out. Why do you think that is?
In all honesty, I have no idea because, Chris, you bring up a great point. Why not antihypertensives? I mean, the data shows that, yes, 1 in 4 Canadians will develop diabetes or at risk for diabetes in their lifetime, but why not high blood pressure, which is 1 in 2 Canadians? It just seemed to Chris's point that here we have two isolated things. So why did we not go far enough? And that I don't quite understand. Make no mistake, contraception, absolutely. Why not? For example, 1 in 7 Canadians are, they're not. Less 50% of Canadians will go through menopause in their lifetime. Why not hormone replacement therapy? Right. Why is it that, for example, we're just covering women of reproductive age? Obesity affects 30% of Canadians. Why aren't anti-obesity medications being covered when, if you want to talk life-saving or cost-saving, these are huge cost-saving medications?
Yeah. We'll go to Jessica now in Victoria. Hi, Jessica. Thanks for calling in.
Hi.
So how do you feel about the details of this new Pharmacare plan?
I think it's a great beginning, and I'm really excited to see national Pharmacare for real across the whole country. It'll give the federal government massive bargaining power against big pharma. And let's remember that pharmaceuticals are the fastest growing part of the healthcare budget. So we have to take this in hand. Here in BC, we have something called reference pricing, where if there's a lower cost drug that does the same job as a brand new expensive drug, the government will pay for that one. And it's just smart money. You know, a lot of them are just reformulating a drug and dyeing a pill a different color. I saw an estimate that in the first year of National Pharmacare, we would save at least $2 billion of our tax money from the bargaining power. So I'm all in, and I think it's the most humane thing to do. And one more thing I wanted to say about the diabetes medications. When insulin was discovered and formulated, the discoverers gave it to the world for $1. They never intended people to be hosed by Big Pharma in order to survive.
Thank you for raising that point, Jessica. And Doctor, how do you feel about Jessica's statement? She's all for this. She thinks this gives the province tremendous bargaining power.
I think Jessica's saying the same thing I am, and the same thing Chris is saying, which is we're all for this. It just didn't go far enough. And to Jessica's point, insulin was a Canadian discovery. You know, Banting and Best sold the patent to the University of Toronto for $1. Never intended for this to be something that was off limits for Canadians. And I think all too often as Canadians, we say, oh, well, our drugs are at least cheaper than the US, but that's garbage. You know, it's this point that we can all agree this is the right thing to do. As I think socialized healthcare is a part of the Canadian fabric. It's just who we are. We really are that kind of group of people. And we need to look at the fact that healthcare has changed in terms of its delivery. And the vast majority of healthcare is now delivered in an outpatient setting, and costs of healthcare have skyrocketed. And to Jessica's point, the government spends more money on pharmaceuticals than it does on physician costs. And so that's a huge area where I don't think Canadians realize that when you have every single province united on a national formulary, you can then literally buy your drugs in bulk, to be very frank, and you have far more bargaining power as to how much those medications will cost. My only concern, quite frankly, and is not only that we didn't go far enough, but when we expand this national Pharmacare, or formulary as we call it, which is essentially the list of drugs that are now covered nationally, are we going to expand it to the top of the class or the bottom of the class? In other words, are we going to meet what is covered the most in each province? So for example, in British Columbia, we have the best coverage for diabetes agents, or are we going to go to what's minimally covered in a province? And I think it's in our best interest, when we sit down to come up with this formulary, is for the government to ask key stakeholders about, newer agents. There is a huge position, to Jessica's point, for us to sit down with Big Pharma and say, all right, you have these new drugs, they're super expensive. Well, we have a country, and here's what we're willing to spend. And so that really puts us into a powerful position. But again, it didn't push far enough.
It is 12:19, 1:19 in the Mountain Time Zone, and this is BC Today. Let's hear some more reaction to Ottawa's Pharmacare announcement. Federal NDP health critic Don Davies says today is a historic day.
Canadians will be able to access insulin, diabetes medications and devices, and contraception as a matter of right and not privilege. This means that women will have better control over their reproductive health and more freedom to determine their own futures. Parents will be able to drop off their diabetic children at school or daycare without fear, knowing that they can monitor their glucose levels in real time from their phone.
Don Davies is the NDP's health critic. He's also the MP for Vancouver Kingsway. He was speaking in Ottawa this morning at the announcement to unveil details of the federal government's Pharmacare plan. It includes an initial commitment to cover some diabetes treatments and contraception. It will establish a fund to support diabetics who need access to syringes and glucose test strips to manage their condition. The exact types of contraception covered by this program have not yet been chosen, but the government is promising, quote, a comprehensive suite of drugs and devices eventually that will be covered in provinces and territories that sign on. Give us a call and tell us what you think. We're asking, what would this coverage mean for you? And what else should the Pharmacare plan include? Our toll-free number is 1-800-825-5950. That's 1-800-825-5950. In the Lower Mainland, you can call 604-669-3733 or pound 690 on your cell phone. You can also contact us by email, bctoday@cbc.ca. We're discussing Ottawa's long-awaited details of its Pharmacare plan, and I'm with Dr. Ali Zentner. She is a physician and specialist in internal medicine, diabetes, and obesity with Revolution Medical Clinic in Vancouver. Doctor, how would a federal plan help or change the provincial one?
It really does depend, Amy. So
Okay.
it depends, particularly in this province, it depends what's covered, right? So in a perfect world, if we had a national formulary that covered things that weren't even available here in British Columbia, absolutely. That would be a really positive thing.
Right.
I guess the concern is and again, I should say, I'm a huge fan of this. I think the problem was, this is national Pharmacare for two things. And if you look at exactly what's being covered, I can only estimate that it's probably 10 drugs that are on board, right? Because, for example, it's covering insulins, it's covering diabetes, continuous glucose monitors, I think lancets and sort of diabetic supplies.
Yeah.
I believe 3 diabetes medications, but not some of the newer ones. So, for example, the newer incretins like semaglutide and that are not covered. And then it covers, I believe, as far as contraception, I'm going to guesstimate and say maybe about 3 or 4 agents. So you're talking maybe a dozen items on a formulary right now. I think a national formulary that is expanded to meet the needs of Canadians and the needs of the future of medicine is going to be huge and a positive thing. The concern will be in the details in terms of, as you sort of alluded to which provinces will sign on,
Right.
what will that mean for those provinces, et cetera. And for, let's say, a province, for example, like Saskatchewan or Manitoba that doesn't have a robust formulary for certain things like we do in British Columbia, you have to decide, is it a step up or is it a step down to meet a middle line? And I think if the government's going to do this properly, my big worry is they're going to screw this up and they're going to literally dumb this whole thing down just to get it through with this idea that, well, at least it's a start.
Right, that it's better than nothing. And Health Minister Mark Holland said Ottawa will evaluate how this first phase pans out before deciding to fund something more extensive. So, this incremental approach could end up, could it end up sort of harming people that aren't able to access that medication they desperately need right now, instead of just going in and providing a more fulsome coverage?
Exactly. And I think that's the big concern that I have, is this idea of, all too often in healthcare and as Canadians, we say, well, something's better than nothing. And is it? Should that be always our method as a physician? Is that what I say to patients? Well, at least you had a day. Really?
Right.
Is that, we talk about quality of life and truly medical excellence and do no harm in medicine. And these are hallmark principles. And so, not just as a provider, but as as a citizen, as a voter, and as a patient, I challenge this government. And I should say, as an aside, Canadian physicians don't actually have a drug plan. We have to buy our own, ironically. But as a physician, I challenge this government to actually teach to the top of the class and not to the.
Is there a risk that a physician may end up prescribing medications that are covered, which aren't necessarily best for the patient, but will be more affordable for them?
So we do that every day.
I
we do
suppose.
in British Columbia. This is the thing. I'm a Canadian physician who practices obesity medicine. And as you know, and you've talked about this on CBC before, that one of the most significant prevention items in this country would be treatment of obesity through some of the new pharmacotherapeutic options, none of which are covered under any formulary. So we, every single day, as physicians across the country, regardless of which province we practice in, one of the first questions we ask a patient is, do you have third-party insurance? And so we already have a two-tiered system in this country in terms of what I prescribe. For everything, to Chris's point, our first caller, for heart disease medications, blood thinners, is patient covered for some of the newer agents or not? Cholesterol medications, pick a class, and the first thing we ask ourselves is it covered under formulary or their third-party plan?
Right.
That's a problem.
It is a problem, and I apologize for asking that question. I just wanted to really clarify that this is something this is the choice that physicians make, and that the patients are the ones that their health can bear the brunt of it. I'll bring in another caller now, Tim in Kamloops. Hi, Tim.
Hi there. Yeah, very quickly. I'm glad your guest said about physicians not being covered for medications. So correct me if I'm wrong, but albeit, even though it's a small step, I always find that those who are always opposed to this over the years, I'm of a certain age and I've heard this before, is that those who are opposing it always seem to have their own medical system and coverage, especially politicians who like to say it's bad even though they're covered and covered by the taxpayer. And then you've also got private sector people who have their own medication programs, and the dental care that's also going to be, I would lump in there as well because of a health issue. It's really interesting to hear people who don't want this because it seems that they already got it.
Very valid point, Tim, and I do appreciate you, Doctor, bringing that up, because I think it is something most people are surprised to know that doctors themselves do not have this wonderful coverage and access to all of these medications, at the drop of a hat. There's a cost to you.
And let's not, this isn't about, that's a whole other show, but this isn't about us.
No.
Let's be clear. Tim, I agree with you 100%. I've met with the BC ministry and said to them, ironically, the people who work for you actually have better drug coverage than the people who voted for you. So, let's be clear that I agree with you, Tim, that this is a step. But again, I don't know. I think most of your listeners would agree. It was like a wah wah. Like it was this huge buildup that we've been waiting for, and it was two things. Like I was shocked to hear that that's it. And so let's call it what it is. I think it was, if you read in the book of healthcare, this was maybe the foreword, not even. It was sort of even the dedication. It wasn't even chapter 1. And so I guess the concern I have is it's a tiny drop. And I challenge this government to advance this a lot quicker. So I worry that what will happen is we'll institute this, and in a year from now, we'll evaluate it and then maybe add other things to it. And I guess it's also helpful for Canadians to understand the timeline around instituting this. So, okay, we're doing diabetes and contraception, or we're doing some diabetes and some contraception now, and then next month, is it antihypertensives and antibiotics? And then the following month is, so it's that kind of things. A perfect example is, why weren't antibiotics on this?
Yeah.
Or That's odd, isn't it? Or why weren't antihypertensives on this, which quite frankly are many of which are generic anyways and quite inexpensive.
Right,
but
to be more cost effective.
Yeah. Why weren't cholesterol medications on this? It was arthritis medication, antidepressants, mental health we talk about all the time.
I found that especially interesting that the mental health concerns weren't addressed.
Smoking cessation, that's an easy one, don't you think? It just seemed like that, okay. And so I guess my criticism was, okay, who were we trying to appease here?
Yes, and it does lead people to feel that it's just political maneuvering, ahead of a potential election. But that's probably another show as well. Doctor, thank you.
But sorry, just to interrupt, which is a real shame because let's be clear, this is a big deal this is historic. And in 1947, when Tommy Douglas had a vision for socialized healthcare in this country, I mean, I don't think he expected to wait 75 years for this.
I certainly think he did not. Dr. Zentner, thank you so much for joining us. It was a pleasure.
Thanks for having me. You have a super happy Leap Day.
Happy Leap Day to you. Dr. Ali Zentner is a physician and specialist in internal medicine, diabetes, and obesity with Revolution Medical Clinic in Vancouver. This is BC Today on CBC. We're on Radio 1, CBC Television, and live streaming on our website, cbc.ca/BC, YouTube at CBC Vancouver, and on the CBC News app. But first, here's the CBC News with Rob Zimmerman.
Good afternoon. The Coquihalla Highway has reopened. It's been closed in both directions for several hours between Hope and Merritt due to a vehicle incident. Meanwhile, winter storm warnings continue for the Coquihalla Highway 3 and the Trans-Canada from Eagle Pass to Rogers Pass. Avalanche Canada has issued an immediate warning to backcountry users of very dangerous conditions in wide sections of the province, stretching into Alberta through the weekend. The agency says mountains in southwestern, northwestern, and eastern BC all have weak layers of snow established earlier this month. And a woman is dead after she was hit by a vehicle early this morning in Souk. She was walking along Souk Road at about 5:30 when she was struck. Her name has not been released. The driver remained at the scene. And taking a look at the forecast, as I mentioned, winter storm warnings continue for the Coquihalla Highway 3 and parts of the Trans-Canada. On the north coast, windy this afternoon with a chance of showers or flurries and a high of 4. Highs to -12 and mainly cloudy in the Peace. In the central interior, lots of sunshine this afternoon with a high of -4. Highs up to 6 with showers in the Kootenays. In the southern interior, including Kelowna, a mix of sun and cloud with a high of 7. And a bit of sunshine this afternoon in Greater Victoria. A chance of showers in Metro Vancouver and the Fraser Valley with highs around 7. That's your CBC News update from Vancouver.
Thank you very much, Rob, and welcome back. We did receive quite a few emails regarding our previous guest talking about the Pharmacare program. Hugh writes, we had to pay out of our own pockets for shingles vaccine. It was the equivalent of a month's groceries. So why are lower income Canadians put at risk of constant pain and even vision loss from shingles? And why are we wasting medical resources on a condition that can be reduced in frequency? Shingles vaccine should be close to the top of the Pharmacare wish list. Todd writes, I had a kidney transplant on March 31st, 2010. BC is the only province that covers all of my anti-rejection drugs that I am required to take for the rest of my life. This program should cover all anti-rejection drugs and transplant-related medications for every organ transplant patient, regardless of where they live in Canada. And we did receive an email from a leap year baby, and a happy birthday to everybody that is celebrating today. Amanda writes, I am a leap year baby and I absolutely hate it. I'm sorry, Amanda. There's something so odd about not having an annual birthday. And when it does finally roll around, it's always a bit disappointing because I've waited so long for an actual birthday that I just end up not caring anymore. This morning, my husband insisted I was not allowed to be a grouch today. He knows me well. P.S. On a side note, sometimes I can't fill out online forms because February 29th isn't an option when entering your birth date. And of course, you can let us know if you are a leap day baby. We would love to wish you a happy birthday, but also share your experience of what it is like when you only get to celebrate your real birthday. And welcome back, and thank you for joining us on CBC Radio 1 and live streaming on the CBC News app, cbc.ca/BC, and on the CBC Vancouver YouTube page. Demand for in vitro fertilization has grown, and now the BC government will join 7 other provinces in funding one round of IVF treatment. This was announced in last week's budget. It will begin next April, so 2025, and will cost the province $34 million a year. So we're asking, why has there been an increased demand for IVF? And what's prompted you to seek fertility treatment? If you'd like to share your journey, you can call us 1-800-825-5950, 604-669-3733, #690 on your cell phone. And you can email bctoday@cbc.ca. Dr. Beth Taylor is Clinical Associate Professor in the Department of Obstetrics and Gynecology at UBC. She's the founder and co-director of the Olive Fertility Center. Good afternoon, Dr. Taylor. Thanks for joining me.
Thanks for having me.
So currently, what is demand like for IVF treatment?
You know, there's a lot of people who need help to get pregnant in BC. And year after year, we are seeing more and more people wanting to access fertility treatments. And IVF is the one most people know about. It's the most successful, but it's also the most expensive. Demand has been climbing, and I anticipate it climbing even more with this announcement.
And why do you expect it to climb, just as it becomes more affordable for people?
I think so. Certainly a certain fraction of our patients, which I would estimate roughly maybe a third of our patients, or maybe more, don't choose to go into IVF treatment because of the cost.
Mm-hmm.
So cost is a barrier for those people. And suddenly if you remove most or all of the cost of that, that's going to really increase the number of people wanting to pursue IVF treatments. And we've seen that in other provinces. As you mentioned, many other provinces fund IVF treatments.
Mm-hmm.
And we learned from their experience that demand goes up. Roughly, it triples. So right now in BC, around 3,000 IVF treatments are done per year. And we're anticipating then, based on Ontario and Quebec's experience, that to go up to close to 10,000 cycles.
That is a big jump. How, for people that aren't familiar, how does IVF work, or perhaps what are the different forms that it can take?
Right. No, good question. IVF has been around since the late 70s,
Mm-hmm.
but what it involves is a person's eggs are extracted from their body. So we go up through the vagina with a needle, and we go into the ovaries, and we'll suction out the eggs that are in the ovaries. Not all of them, just a certain number that they grow that month. We'll extract them, then we'll get sperm, and we'll fertilize those eggs, and many of them will become embryos, and then many of those embryos will be healthy enough, and the healthy ones we'll put in a person's uterus, hoping that they then go on and fall pregnant, which they do about half the time we put an embryo in.
Mm-hmm. How challenging is it for people to go through this? And I mean physically, but also emotionally, the impact that it can have on an individual, on a family?
Oh yeah, and the impact is beyond just the individual or their partner. It often extends to, grandparents are looking for grandchildren, and people are looking for siblings, and so it really affects. It's a whole family problem when people who really want a child can't have one, and the emotional toll is no doubt real and large. Depression, anxiety, sadness, ending of marriages, family discord. It's really significant what the disease of infertility does to people.
Mm-hmm.
And most people, if we're assuming that the paradigm of a straight couple having intercourse and trying to get pregnant, most people are sort of trying for a year or more often before they come to a clinic like ours. Then we put them through some less invasive treatments, hoping something simpler and cheaper than IVF will work. Sometimes it's surgery, sometimes it's some pills or injections and things. When that doesn't work, they end up in IVF. And I say that to illustrate how long the process can be for people. It can be years of, wanting a child and not finding success. So one of the things I'm hoping that this funding will do is it will shorten the time of people suffering too. Like if now there's less of a financial barrier to get a highly effective treatment like IVF, perhaps they'll get that baby sooner. So that would be another bonus of seeing publicly funded IVF in BC.
And I'm glad you mentioned that trickle-down effect or the domino effect of that one issue, the infertility itself, how it can impact so many members of the family and cause so much, I guess, trauma in a sense, that hopefully this funding can help to ease, if not dispel. We would love to hear our audience's experiences with IVF. We would love to know what your reason was for IVF and what that experience is like for you and what you think this new funding will do. You can call us 1-800-825-5950, locally 604-669-3733, email bctoday@cbc.ca. And in fact, I do have an email to read out from Abby, and she writes, "Thank you for continuing the conversation about IVF. We as a family have paid for IVF 3 times, twice for myself and once for our very generous egg donor. I am one of the lucky warriors to have made 1 baby from 3 rounds and over $50,000 out of pocket. What I wish people understood about IVF is that no one would choose to do this. The physical pain of the process is nothing compared to the emotional toll it takes on your body. Weeks of daily internal ultrasounds, blood work, injections to wait and see if anything is working. Waiting for the call or the portal to tell you if you can even move into the next state. The waiting is awful. We learned early that 36% of the time IVF works. You think it's the silver bullet when nothing else works, and that's just not the case. And so many people have to line up that even if you're lucky, find out what might need fixing." Thank you so much for that email, Abby, because I think that does hammer home the point, Dr. Taylor, that you were also trying to make, that this is an incredibly arduous path that a lot of people take. People don't choose IVF as a quick fix or to jumpstart the process of getting a baby quicker. It can be very hard. Do you think, as we sort of saw in light of the Pharmacare announcement that they will be covering contraception with this funding announced last week from the provincial budget about the IVF treatment, are we finally getting to a point where reproductive health and sexual health is coming much more to the forefront, that hopefully this is the start of ongoing change and support for people that are dealing with these issues?
Oh, I think so. I think the last year has been really exciting, particularly in BC for reproductive health with contraception. And then I believe we're the first province doing at-home screening for cervical cancer, like essentially the at-home path. I mean, and now this IVF funding, I think it's been those are some really positive things for reproductive health in BC. So it's exciting time. I wanted to jump on with that email you read from Abby.
Yes, please.
And she noted that she used donor eggs. And that made, one of the things I'm keen to hear about with this funding announcement is whether it's going to cover things like that. Donor eggs, donor sperm, surrogacy, sort of non-traditional IVF treatments. And that would be really interesting too. So I wanted to jump on that because there's so many unknowns about what's going to be funded. We'll learn it over the next months to come, I'm sure. But that thinking about whether Abby would have been helped in her donor egg treatment, I wonder, that will be interesting to see.
And to that point, or as you sort of have mentioned, what is right for one person in their IVF journey, if they can allocate those funds to what is recommended by their doctor, and it's not just a one-size-fits-all approach, that this is the money, that it goes to this form of treatment. For someone who is perhaps wondering why their tax dollars need to go towards funding IVF. What would you say to that?
Yeah, I don't see IVF as a luxury item. I think it is a medically necessary treatment.
Okay.
So I view it really from a medical lens. It's a disease that we have a treatment for that works quite well, and why do we exclude that disease? So that's one lens I look at. I mean, a lot of countries too, if you take more a less emotional, perhaps less scientific view of it too, you might just say what this means for population growth, right? A lot of countries are funding IVF because they realize they want to expand their population. Immigration works well, but so does fertility treatment. So there's lots of reasons I think IVF is important. I think I lead with medically important. I think it's societally important as well.
And that is a good point that I don't think a lot of people think about. And in BC, typically I believe our fertility rate, our birth rate is not at its highest point, and that perhaps is something that the government has considered. You did mention with the other provinces that do cover IVF that, as soon as this funding comes, you do see that increase, which makes sense. Suddenly people realize that's an option for them. Are there any other, impacts that having this funding has in those provinces or that we've seen so far?
Yeah, it has really improved access. Now, one interesting thing about publicly funded IVF is it's often the public funding amounts aren't enough. And I hate to say anything negative about this announcement because I'm very excited for it for our patients. But truthfully, that funding amount and is not going to be enough to fund fund 10,000 IVF cycles a year.
Yeah.
So the demand will still exceed the supply of publicly funded cycles. And that's what we've seen in Ontario and Quebec. So they now struggle a little bit with who should access, do we have to gatekeep who might access funded IVF cycles if it's finite, what we can do. And that will be interesting. I know some colleagues in Ontario who don't like being gatekeepers, and these are ethical decisions that are put on people that they have to decide who gets the cycles, when the resource is limited. I guess we have experience, harkening back to your previous caller there, about with transplants, they have to make decisions about who gets a transplant. Well, now I think IVF might become like that. Well, who gets publicly funded IVF? And for some people, that means who gets IVF, right? If they can't afford to pay for it privately. So that will be interesting and exciting actually to see that part. I think that will be challenging for us as a society and as politicians and nurses and doctors and patients to kind of decide how that finite resource will be allocated.
That is such an interesting point, and it puts doctors in that position of, do you go with somebody because, do they get the funding because they have the best chance of it succeeding? Do they get the funding because, they've had the most trouble and maybe need it the most? I hadn't wrapped my head around that, but that's kind of all I can think about right now. I would love to hear your thoughts and your experience with IVF. We invite you to join us. You can ask questions of Dr. Taylor, or just let us know what it was like for you and what your experience was. Call us 1-800-825-5950, 604-669-3733. You can also email bctoday@cbc.ca, and we do have that new text line, 236-330-2623. That is our brand new way for you to join our conversation. We are, of course, talking about IVF and the new funding that was announced for it last week, and I'm joined with Dr. Beth Taylor. One other question that I keep thinking is are people generally successful with one round? Will this help the majority of people that need IVF? Is it a lucky few that will be able to be successful after one round?
Great question. And I hate to give qualified answers, but it's deeply, deeply qualified. So if you're 24 and you come see me and you've got blocked fallopian tubes and you need IVF, your success rate is in the 80-90% from an IVF cycle.
Okay.
But if you come to me at 43, your success rate from an IVF cycle might be 20%. And so it's hard to give a simple answer to what is the success of IVF, which is why at the beginning I said it's 50-50, which is probably true for most people under the age of 40 with not too complex a problem. It's about 50-50 whether the IVF cycle will give you a baby. But it's really variable from 0 to 90% chance that one cycle will work for you. But in my mind, if the person with ovaries is under the age of 40, I think for most people, it's about 50-50. I think that's the number that is safest to quote people.
Okay, that's fair. For somebody needing more than that initial round, and just a ballpark, obviously, because there's so many ways it could go, but how much more additional funds would they potentially have to put out of pocket?
Well, honestly, it's a lot. So to do an IVF cycle, it's about $12,000 or $13,000, and then you pay for your medications on top of that. And for many people, medications are like $5,000. So let's say all in an IVF cycle is, let's just be round up, is $20,000 to do that. Now, if you do IVF and you aren't successful and you have to do the whole thing again, like you don't have any extra embryos or anything like that, you have to do the whole thing again, you're going to be paying $20,000, which is what our patients are currently paying.
Wow. We're going to bring in a caller now, Maya in Coquitlam. Hi, Maya. Thanks for calling in. Hi, Maya. Are you there?
Hi, I'm here. Yeah.
Hi. Sorry about that. So what has your experience been with this topic?
Yeah, so we've been trying. So in 2019, I had a car accident that actually caused some sort of autoimmune condition that's left me struggling with infertility. So I have primary ovarian insufficiency because of it. And so we've been working on trying to have a baby for probably the last 3 years. So we've tried IUIs, which is, the assisted insemination. We've tried different fertility medications. We've done all of the natural stuff, the supplements, Chinese medicine, acupuncture, diet, all that kind of jazz. And so far, no luck, right? So, as this happened when my husband and I were newly married. So as two people who are now, just entering our 40s, we've wanted children both for a long time. And it's been really, really tough for us because we haven't been able to access IVF.
Right.
In fact, we had the opportunity to receive an egg donor and found out it was going to be $25,000 just for one cycle.
Wow.
So, we've been looking at other places in the world that maybe we could go, but I was just commenting when I first called in that when I heard the news, I had to pull over my car and cry because it was such a big relief to hear that finally our province is going to have some support for folks that have tried everything and just really need some assistance.
And you felt hopeful when you heard that announcement.
Yeah, absolutely. So much hope for ourselves, for so many other families, for, a lot of the folks that don't have, for some of the queer couples that don't have the option to just try, right? They need that medical assistance. So yeah. I think it's really great, especially since, I think 3 other provinces in Canada fund this and we haven't had it.
I think it's just the 2, but no, now it will be 3. Maya, thank you so much for sharing that with us. I hear that it has been very difficult, but you haven't lost hope, and that this has sort of made that hope grow. So thank you for calling in.
I really appreciate that curiosity that you were sharing around whether egg donor or sperm donor is going to be covered. We're excited to hear that also.
Well, best of luck to you, and let us know how things work out. Thanks so much. And I'll share an email now from Alex. It writes, I'm a trans man and I'm 22 years old. Ever since I started testosterone at 16, I have been worried about my options for fertility. I have always wanted children, and I know that it's much harder for LGBTQ individuals to receive proper fertility care / options. I find this new funding for IVF to be absolutely amazing. It is an opportunity for me to have children. I am just curious if this funding was also considered for individuals who are from the LGBTQ communities, not just heterosexual straight couples. Thank you so much for sharing that. And we're almost out of time, Dr. Taylor, but how common is this in what you're seeing, that more people who don't fit that stereotypical heterosexual straight couple wanting to access in vitro treatment?
Oh, yes, because, virtually all same-sex male couples will need IVF if they want to have a child. Many cisgendered lesbian couples will also, trans couples will need access to IVF. So IVF. So no, it's a common tool actually in the LGBTQ community to grow family, and we're really expecting that community will be served just as well as anyone will in their family building. It's interesting though, because that group quite often does need surrogacy, donor eggs, or donor sperm, or all the above sometimes. And will funding extend to that? I think that will be interesting to see come over the next few months.
Do you feel hopeful that this is just maybe the first step, and that we will see things rapidly sort of improving and expanding that function? We've only got about a minute left, and I apologize for that.
No, yeah, I think so. I think this is the start of something really positive for BC and for BC families. And we have a history of being inclusive of everyone. So I think this is going to be good for everyone in the province.
I thank you so much for joining us today. It's obviously a topic that hits very close to home for very many people, and just such exciting news for so many families. Thank you.
Thank you very much.
Dr. Beth Taylor is Clinical Associate Professor in the Department of Obstetrics and Gynecology at UBC. She's the founder and co-director of the Olive Fertility Center. And that is it for our show. Thank you so much for calling in and joining the discussion. You can always email us, bctoday@cbc.ca. And you can also text us at 236-333-2623.